Hi everyone, this is Dr. Demchenko, and today I'm going to tell you what to do if you have pain in the back of your knee joint. The fact is that this is where the muscle tendons are located, the muscles themselves, and very rarely is it really a joint pain. More often than not, these pains can be managed on their own. Let's give it a go. There are many causes of pain in the back of the knee joint, but we're going to try and sort out the ones that are muscle-related, which are the most common. The fact is that the muscles that attach to the posterior surface of the knee joint are from the hip on one side and from the shin on the other side. The calf muscle is attached to the thigh bone and therefore lines the entire hamstring fossa. So very often, if the pain is right in the center of the hamstring fossa and you can feel it, it is excessive tension of the calf muscle directly in the area of its attachment. If the pain is located medial lateral, that is on either side of the knee joint, it can often be tendinitis of the posterior thigh muscles. Also directly below the knee is the hamstring muscle, which is quite short and very often goes into spasm and gives you pain. You can also see that there are vessels and nerves in the hamstring area. In self-massage, I will tell you how to avoid hitting them and injuring them. How can you assume that the pain is specifically related to the muscles? Firstly, you will have painful active and resistance movements. You can try testing yourself in the following way. Put your heel support and try pulling the heel towards yourself or pushing the heel backwards on the support so that the muscles in the back of the thigh are activated. If this reproduces pain, it is highly likely that the muscles are to blame. The next test can be our palpation, that is feeling the posterior surface area of the knee joint. To do this, take 2 thumbs, put them under the knee and feel the sore spot. If you can feel pain, it is probably also a muscle. Now what can we do about this problem? The first thing we can do is self-massage the thigh and lower leg. You can use different massagers for this. You can even use an ordinary kitchen rolling pin. I will use a massager similar to a rolling pin. From a sitting position, you can apply pressure on the muscle. The pressure should be strong enough for you to feel the support on the bone through the rolling pin, and slowly from top to bottom and bottom to top, we will massage the muscle. Do not go to the Achilles tendon, because massaging the tendon will hurt, and there will be no additional effect. When you massage the calf muscle, you must massage not only in the center, but also a little from the corners, so that you can better go to the outer and inner heads of the calf muscle. Go through 10 to 15 movements at a time. After you have massaged the calf muscle, you can massage the thigh. To do this from this position, you can take the rolling pin, pull the massager towards yourself, create pressure on the thigh, and slowly move the rolling pin back and forth. Also, do not try to go too close to the knee joint, about 5 centimeters to the knee joint, because too close to the knee joint there are many vessels and nerves as well as tendons and muscles of the back part of the thigh. Once you have made 10, 15 massage movements with the rolling pin, you can move on to massaging the hamstring area itself. To do this, we take the thumbs, put them under the knee, and feel the pain point. It is important not to press too hard on the painful areas under the knee at the beginning. If you feel a throbbing sensation under your fingers, or a sharp pain that shoots down your leg, or a slight numbness, you need to move your thumb slightly to another area. That's because you've hit a vascular nerve bundle. It's not dangerous. You just don't need to push there for a long time and hard. Next, after you have shifted and found the pain point, but this pain point does not manifest itself as a throbbing or shooting out, try squeezing it. You don't have to fidget there for long, just press and wait. The first 15 seconds may be quite intense pain, but then it gets easier. Next, the point should reduce its pain impulse by a factor of 2 or 3, after which you can remove your hands and look for another point. It is more convenient to press the points on the shin on the back side with the thumbs, while the points on the thigh directly in the hamstring are pressed with all the other fingers. You can fold your fingers in this way and slide them under the thigh. Find the pain point, hook the tenor of the thumb on the leg, and make this movement. With this movement, you will be able to pinch the painful area and wait for it to relax. After you have done this self-massage, be sure to retest your knee. See if the pain has decreased when squatting, walking, and running, and if there is less pain when resisting with your arm. If the pain has decreased, then the cause of the pain is not in the knee but in the muscles that are attached to that area. If this video has helped you, write your comments, ask what other topics would be of interest to you. We will definitely deal with them. Bye, everyone.